So I'd like to introduce our first speaker. It's Jaume Vidal, who's a Senior Policy Advisor at Health Action International, to speak about the paper that is under discussion today and the current state of affairs around the TRIPS agreement at EU and global levels. Jaume, you have the floor.
Thank you, Alex, and welcome everyone to this public launching of this policy paper that I hope that most of you have already been able to read and check. So let's get to the issue in the sense that why this policy paper? Why yet another policy paper on IP? I think that there are like 4 reasons which make this paper from our point of view, compelling. First of all, it's a relevant paper in the sense that it addresses one of the major factors like shaping access to health technologies currently, but also like really one important element in the current biomedical research and development model. We believe it's timely because it comes at a time where we are witnessing discussions, both at the global level at WTO, but also the regional at EU, that are going to shape like the IP legal and policy framework for like the next 5-10 years. And we believe it's also a necessary paper. Why it's necessary? Because it's evidence-based, because it's technically sound, and it's accessible. And it's part of our strategy of building a propositive agenda. And when we say a propositive agenda, it's like the last element, which I believe it's important in this paper, that it's like complementary, in the sense that our ambition is really to contribute to a conversation. And to do so, we are building a narrative. This policy paper is part of, we can say, like a larger group. It's like a trio of papers. This one on IP and access to health technologies, lessons from COVID. Another one that Salud por Derecho has elaborated under, like, with our cooperation on licensing of public funded technologies. And a third one on diagnostics within the AMR framework. In a sense, what we are trying to do is really to inform the conversation in such a way that a health-oriented agenda is closer and more possible. Also, regarding IP, I think it's important that we bear in mind also what HAI has been doing on the issue of IP and access to medicines and health technologies and TRIPS flexibilities. Like we have already one manual from like 2008 on the use of TRIPS flexibilities. And recently we had set up a TRIPS flexibilities navigator, which is like a tool for like advocates, lawmakers, and other interested in like knowing how to use flexibilities in Europe. And you have the links in the chat. And also we have a TRIPS flexibilities head map to see how TRIPS flexibilities have been used in the European context. We are talking a lot about TRIPS, and this paper, of course, it devotes like quite a lot of attention to the agreement, but it does so taking into account what was behind and what was before TRIPS. In the sense, like, even though for like the younger amongst us might only remember like a life under TRIPS, there was something before TRIPS. It was not the complete void. So in a way, it's like before WTO, before TRIPS agreement. I mean, it was a very different IP protection enforcement landscape. With the arrival or the approval of the TRIPS agreement, we see how countries were compelled for the first time to really raise their standards of IP protection, and in some cases, for the first time, were granting patents on pharmaceutical products. That had a clear impact on access to medicines, in the sense that something that it has been established, it's like monopolies and high prices normally go together. And as a result of this, we have like the Doha Declaration of 2001. It's like the first like very public sign that like the bargain upon which the TRIPS agreement was built, in the sense that you enforce IP protection and we make sure that you have access to innovation, had its discontents, in the sense like there's like an important group of developing countries and civil society putting pressure, saying, no, this deal is not working for us. We have the Doha Declaration that really ratifies the use of flexibilities, that it really states explicitly like that the agreement has to be really, in a way, really re-examined. So it's like its application has not negative effects on like the public health of certain countries. And here, like, that's something that I think it's important that we mention in the paper, and I would like to highlight here. It's like we have the Doha Declaration that there is like agreed by like all WTO members after really long, really night-long discussions and negotiations, but we have one paragraph, that's the paragraph 6, that it's not agreed upon. Since the paragraph 6 that refers to how those countries that have no pharmaceutical manufacturing capabilities can make use of flexibilities. And that's a challenge. That's a challenge that it takes over 2 years for WTO to really address, you see, to address in a successful way. Since we have like a first deadline that passes, we have then like the so-called like 30 August 2003 solution that comes and goes. And overall, it takes like more than 10 years for like the TRIPS agreement to be amended in such a way that it includes the possibility for like countries with no pharmaceutical manufacturing capabilities make use of TRIPS flexibilities. The issue here is like the mechanism for these countries to make use of, like, for example, compulsory license. It's so cumbersome, it's so complicated. It has attempted only once. Why I believe that these discussions around paragraph 6 are so important? Because in a way, when the COVID-19 pandemic arrived, it arrived into this context, in the sense that it was already on these difficulties like experienced by Global South, by developing countries, on making use of these facilities, on having access to health technologies, that the pandemic hit. And then we have this proposal from South Africa and India, like that they are proposing to waive certain dispositions of the TRIPS agreement for health goods related to the fight against COVID-19. I think it's interesting that such a proposal that was really wide at the beginning, that how it very rapidly gained support. I mean, not only from WTO members, I mean, at the end, like in 18 months, it gotten more than 60 formal co-sponsors, but also from civil society. Here, it's something that I think it's important to mention. It's in the sense that it was civil society, like from the South, leading this effort, with like organizations like Health Action International in the EU, pushing the EU, but really following the lead from other organizations. And I think that's why I think that we are so lucky today to have Candice among us to really illustrate this. So the issue here is like, okay, 18 months of pressure, 18 months of campaigns. We had letters, we had like declarations from the European Parliament. We had really, well, it was really a very strong mobilization, and the result was, well, there's no other way to put it, disappointing, in the sense that the TRIPS decision that is adopted at the ministerial conference, like the 12th ministerial conference in June in Geneva, only applies to vaccines. It's well, we could say that it's a little bit like an improved version or like abbreviated version of compulsory license. So we could even be questioning if we can talk about a waiver, but it is what it is, in the sense that we live. I mean, that we live in the world that it is, not the world that we would like to be. But well, we have to really try to make it better, right? So the issue here is like it set a deadline for 6 months to extend this decision to like the diagnostics and therapeutics. And I think that it's important I think that we have to be very clear on this, in the sense like as high we were not satisfied with this decision. It's not like what we had been working for, but now that we have this, we wanted to extend it to diagnostics and therapeutics, and we are working on this direction. This is like the way forward that I'm really like interested in examining, and that this paper also tries to really design. I think that there are really 4 like big categories that of like way forward, or that things that I consider that are like a priority that I would like to talk about today. But also, and like taking advantage of this format where you have the screen like this, so I can put this long paragraph, I would like to share like something that we published back in March, like when there was like the first like draft of the decision when it was released, because here are like the main points of our thinking, both on the TRIPS waiver, both on the conversation on IP and access to health and technology. As I said, there are like 4 big areas where I think it's important that we dare to say what we want, where we want to go. First, roles and responsibilities. We still believe that WHO has a lead role to play on IP and health. And such a role, it has to be really through focused technical cooperation on the use of flexibilities, but also like what is known as like the pre-grant flexibilities, like namely like patent examination. We believe that really WHO has a role to play in this specific field. It has shown like very interesting cooperation with UNDP, very interesting cooperation with the South Center. And what we need also, it's like, let's not forget WHO, it's a member-based organization. So we need like governments to push WHO to really embrace this agenda of a health-oriented IP. The strengths and opportunities, I think it's important that we have now, and I think it was very clear during the waiver discussions, people realizing like the impact of IP-based monopolies on access to medicines, the impact on prices and availability. It's important to keep on like reminding people that what happened with vaccines, like not only that there were not vaccines for like large groups of population, and prices were being set like according to like expected profits and not like the real like ability of governments to pay. It's happening now with other medications. It's happening now with like life-saving like health technologies. So the issue is like we have to keep on insisting, in the sense like we never said that IP was the only issue, but we say it's a major issue and needs to be addressed. And I think it's very important that we remind the public, but also lawmakers, of the primary social function of innovation, in the sense like I mentioned, like right before I was mentioning like patent examination. Okay, we have to be sure that every patent that is being awarded is justified. I mean, we cannot really be living with like products that do not bring any sort of therapeutical like improvement into the market, or that it's like marginal innovation. And then we come like to the most like the thorny issue of weaknesses and challenges, because here it's really, we have a clear weakness where like I was like talking with a journalist and I was telling her, yes, this we want to really engage in an in-depth conversation on IP and access to health technology. And she asked me, okay, where's going to take place? And it took me, no, it didn't take me by surprise, but it's really, we don't have right now an institutional space where we can have this discussion. I mean, we could have it in WHO, and as I mentioned, I think it should be the space where to have this, but it's difficult. It's clearly not a WTO. I mean, it's after the waiver discussion, it's very clear that it's not the space to have like health-related discussions. And I think that WIPO, it's neither like another like venue which is really conducive to really our goals. And then we have like the challenge. We have the challenge of we need to reach minimal consensus, all concerned parties. We really need to have like some sort of understanding with industry, governments, civil society, academia. I mean, we cannot keep on talking like beyond each other and really repeating our mantra, like some saying there is no innovation without the other saying like patent skill. No, we have to reach some sort of an agreement, and it's something that we are really willing to engage in looking for this consensus. In terms of timelines and deadlines, and I think that Candy is going to be speaking about what's going on with the pandemic treaty and the opportunities there. I think it's important that we have a first deadline with the December, like the deadline to the extension of the TRIPS decision for diagnostics and therapeutics. And also we have very interesting like policy processes in the European Union, like we have the European Pharma Strategy. We have also like the assessment of the supplementary protection certificates. And we have also like the possibility of a new instrument that it's called the transferable exclusivity vouchers for AMR, which is something that we can talk about it later on, which is like something it's really, you see, we had TRIPS, then we had TRIPS Plus, and the European Union, well, keeps on coming with new ideas on how to protect intellectual property, like beyond the idea of patents. And that's something that has to be discussed and has to be really examined. And this was my presentation, and thank you for your attention. Here's like the navigator if you want to check out, and my mail for anything. Thank you.
Oh, thank you for that, Jama. Very interesting. If anyone has any questions for Jama, I'd ask that you save them for now, as we'll come back to that after our next speaker. But for those who haven't read the paper yet, the link has been posted in the chat, and we'll do so again for those who joined us later. Now, next, it's my pleasure to introduce Candice Sahoma, who's Advocacy Advisor for the MSF Access Campaign, and whose expertise looks at the intersections between intellectual property, medical innovation, human rights, and access to medicines. Now, I'm going to give the floor to Candice, but first I need to share my screen. So we'll come back for questions later. Let me share my. I'll share your presentation, Candice.
Okay, thank you. Thanks, Alex, and thank you so much for having me. As introduced, I'm Candice Sahoma, and I'm the Access Campaign Advocacy Advisor based in South Africa. So a lot of my work actually looks into policies and I mean advocacy more generally in South Africa. So as Jam has mentioned that, I think with the TRIPS waiver proposal, I think it was such a pivotal time during the pandemic to come up with a solution that would ensure equitable access to all COVID-19 medical tools. And this was a proposal that was, as you all know, proposed by India and South Africa, to waive all COVID-19, to waive all patents rather on COVID-19 medical tools. And what was proposed really in a real TRIPS waiver would have encompassed the full waiving of all major IP, cover all COVID-19 medical tools, as well as include all countries so that they could override monopolies on COVID-19 medical tools and open access for all. And I think, unfortunately, after 20 months of negotiation, an inadequate outcome, which excluded diagnostics and therapeutics and only centered the decision on vaccines, and also didn't waive all IP, as well as excluded other countries, and it did include all countries. So the outcome really did not solve the problem of global inequitable access to life-saving medical tools for this pandemic. Instead, it actually set a precedent, a terrible precedent for future global emergencies where solidarity and equity are urgently needed. I think very important to highlight also with the exclusion of diagnostics, for example, we missed an opportunity to address trade secret issues, which are very relevant for diagnostics, as the original waiver proposal suggested. IP for diagnostics is more than just patent, and includes know-how, trade secrets, and industry processes. And an example, something that is very close to home, which really did affect us, is around the CFID gene expert. In the onset of the COVID-19 pandemic in South Africa, and also more generally in low and middle income countries, they received very little supply of critical gene expert automated PCR tests, although having invested in machines for TB, and think a greater part of clinical trials for this gene expert were done in low and middle income setting, and particularly South Africa. But we struggled actually to get access to this, and because of supply constraints by CFID, and countries were obliged to move to centralized PCR testing, which has its limitations, and not all people in need can reach such a centralized testing. So, and also resorted to using AGRDTs, which generally have lower sensitivities than PCR. So if there was a wider access of point of care PCR diagnostic tests such as Gene Expert, more people could be tested for COVID by PCR in decentralized setting. And I think similarly, even with therapeutics, that there were some limitations, even with the voluntary license on therapeutics, that to some extent it excluded many countries, and even when it was specified for certain countries, like for example in South Africa, with one of the licenses, that it was actually only available for the public and not necessarily the private purchase. So yeah, so I think all those things came up, or like those I think bearing in mind all those limitations with accessing diagnostics as well as therapeutics. So the decision to narrow it to vaccine was a huge mistake. And I think despite ongoing negotiation, I think it's also yet to be seen how countries would use the agreement that was reached at the MC12. At the moment in South Africa, I think it's also very unclear on how this will be used. I think we don't also have much information on that, as there is also very little visibility. But it's, I think, going forward important for countries to remedy this mistake in the current negotiation, to include diagnostics and therapeutics, and address shortcomings of the decision itself. Next slide, please. Yeah, and I think also looking forward is also the need for countries to also look at their own national patent laws, and particularly in South Africa, where we are still in a setting where we, our patent law are still very much in favor of monopolies, and favor of pharmaceutical, and really not sort of don't facilitate access. And we as civil society in South Africa have been calling for a patent law reform for over a decade, and we have been doing this under a coalition called Fix the Patent Laws Coalition. And this is basically a coalition made up of plus 40 organizations in South Africa, and we have been calling for a patent regime that that includes these TRIPS flexibilities, because the current system does not. There isn't like any examination system. There isn't any examination of patents that if companies apply in the country, they're just given patents without any examination. there isn't like, there's still like a cumbersome process of granting a compulsory license. There isn't an administrative patent challenge system to allow for pre and post grant challenging of patents. So there still needs to be reform in our patent system as it stands. So only in 2018 we managed to have, or rather, South African government adopted a progressive IP policy, which is reflective of TRIPS flexibilities, and also made efforts to recruit about plus 20 patent examiners to examine these patents when applied for. However, the patent examiners haven't started with examination because we're still waiting for the bill. We're still waiting for our law to be reformed in order for the IP policy to have effect. So yeah, so it's still something that still a question for us, because I think with the patent examiners, they've been recruited in 2017 and have been undergoing training for all these years, and I think they've been getting training from various institutions like the EPO. We also as civil society have done trainings for these patent examiners to try and get them to look at a more sort of a public health lens, an access lens when examining, and that was done in collaboration with other civil society organizations internationally. And yeah, but I think the call for our patent law to be reformed is still ongoing. And yeah, and I think it's been an arduous sort of process. And only I think in 20th of May 2022, the Minister Patel, who's the Minister of the Department of Trade and Industry, announced that the bill on introducing much needed patents reform will be introduced by October 2022. And today we're sitting on the 2nd of November and we still don't have a patent bill that is tabled. So I think it's also quite reflective of the lack of accountability of our government also, and also in light of the fact of how they've had a pioneering role on this TRIPS waiver proposal internationally. However, there hasn't been as much urgency nationally to also move forward move our patent law reform process forward. So yeah, and then as Jeremy mentioned that, I think it's very important also when we look forward, future looking, there's ongoing discussions around pandemic preparedness. I think it's very important that, that we need to have some kind of alignment between the various institutions like the World Health Organization, the World Trade Organization, and WIPO, and the respective agreements to make sure the future pandemic preparedness response mechanisms are supported and coherent and health needs are prioritized. So issues including IP, R&D and access to technology and know-how sharing must be considered and approached together in the treaty negotiation in concrete terms. So I think one of the things is, not just including, so language around TRIPS flexibilities must remain in the treaty and strengthen and shouldn't be just a general principle in the preamble, but should be part of a substantive clause in many chapters, including those concerning achieving equity, supporting local production and supply. So it's very important that it's centralized and, that it's sort of embedded in very important clauses within the pandemic treaty and pandemic preparedness discussions. Pandemic treaty negotiations is the appropriate space in which TRIPS flexibilities must be clarified and unpacked, and also more importantly, that national laws must be conducive to implementing existing and new norms and with objectives of prioritizing public health. So yeah, so I think I'll leave it there for now, and I look forward to the discussion. Thank you so much.